So I am Cecilia Oregón. I'm the Executive Director of the Institute for Health Policy. And at the Institute, we host events and publish information to shape policy and practice on important health topics. We convene experts to share knowledge, spark discourse, advance collective thinking, and explore opportunities to cultivate healthy communities and promote more accessible, high-quality care. This is our first in-person meeting since the pandemic, and we're really excited to be here today and to learn a lot about the topic at hand in mental health quality in the workforce from all of you and from our esteemed panelists. So before we get started, though, I do want to go over some housekeeping. So I want to point out that there are staff working the event today. And the staff are wearing green name badges, or they have a ribbon that's green, so you can ask any of them any questions if you need any help with anything today. So we are recording this event, so I'd ask that you please silence your cell phones. Wi-Fi access, for Wi-Fi access, you would connect to the KP Guest Network and accept the Terms and Conditions button on your browser. All of the information that you need to know about today's events, including the agenda, the speaker bios, code of conduct, COVID attestation information, as well as relevant Institute for Health Policy resources, are available using the QR code that you either received at check-in or that are on your desk. And then I also want to point out that through the QR code, there's also a link to an end of the event survey, and we'd love to hear from you. We definitely use the information that is provided at the end of these types of events, so we encourage you to provide us feedback. Restrooms are located behind the screen wall, down the hall, and to the left, and we encourage you to take breaks as you need them. There's also a mother's room that one of our staff would be able to connect you to if you require it. If for some reason we have to evacuate today, please note where the exits are. There's one, the main exit would be right behind you where you entered the building. And if you have to take a call, again, because the event is being recorded, we ask that you please do so outside, or ask one of the staff members for help finding a room and a quiet space to take your call. Throughout the day, there's going to be opportunities for questions and answers, and so, and then we have also received a number of questions in the registration process that we've tried to incorporate throughout the day already. But during the Q&A, we will have a microphone available, and Nani on our staff will be walking around with the microphone in order to help facilitate that process. Lastly, if you are interested in using social media to communicate information about the event, we encourage you to do so. Please use the hashtag KPIHP. And lunch, importantly, will be served at 12. So to get us started, I wanted to do a little poll of who's in the room. So let me ask if you would please raise your hand if you are either a policymaker or work for a policymaker or with a policymaker. Great, thanks. Advocates or folks that work with advocacy organizations. Great, thank you, welcome. Researchers or academics? Great, there's a couple, thank you. Providers or clinicians? Wonderful, welcome. Folks from Kaiser Permanente? Thank you. And anyone I missed? All right, well, thank you. And then I guess another question is, how many of you have attended one of our IHP forums in the past? Great, thanks, welcome back. And now that we have those items out of the way, I'm going to transition us to the official start of the program with, so I'm happy to introduce Tony Barrueta. Tony is Senior Vice President of Government Relations for Kaiser Foundation Health Plan and Hospitals. In this role, he oversees Kaiser Permanente's legislative and regulatory policy efforts. He leads a team of legislative advocates and policy professionals across the organization. He directs development of our public policy positions to ensure KP maintains a common voice in support of the organization, its members, and the communities that we serve. He is the immediate past board chair for the Public Health Institute. He's a member of the board of directors of the Alliance for Community Health Plans and the California Latino Economic Institute. He serves on the statewide leadership council for the Public Policy Institute of California. And I do know that all of these issues that we'll be discussing today are really important to him. So, Tony?
Thank you, Ceci. Great, thanks, Ceci. And I really do want to add my welcome to everyone. This series of forums that we have been doing for the last 6 or 7 or 8 years was really a brainchild of our entire team in government relations and public policy at Kaiser Permanente, where we've had an interest. Many of us are in the work of doing the day-to-day advocacy on behalf of the organization, working on issues that arise. And one of the benefits of working for an organization like Kaiser Permanente is that we have the opportunity to think longer term, to think more upstream, and that's a result of the nature of our organization, which is one in which we are both in the payer space, in the provider space. We're kind of in a unique role where we see that we're able to step back and, as a nonprofit organization, take the long term. One of the things that's always remarkable to me about our organization is the fact that we have an extraordinarily long tenure of enrollment of our members. People who come to, there are a lot of people who have no idea about Kaiser Permanente, but the people who do come to Kaiser Permanente tend to stay for a long time. I know, for example, in Northern California, the average tenure of enrollment for a Kaiser Permanente member is 14 years, which is really quite extraordinary. And because we offer coverage through the commercial market, through Medicaid, through Medicare, people can stay with us throughout the entire period of their lives and all of the experiences that they're having in their lives. So we tend to take a long view on many issues. And today's conversation is the 6th in a series of these forums that has been about mental health and wellness. So we put this effort into longer range healthcare policy, and the focus on mental health is really a reflection of the organization's concern and interest in the subject, and frankly, some of us who have a very strong interest in this based on our own life experiences, and reflecting the fact that all of us in our society, in all of our families, are touched by issues of mental health and wellness. So it's really critical, and I will be the first to acknowledge that in many respects, mental health has taken a back seat to other types of healthcare issues in the policy space. And so it's been very critical. What we're hoping by bringing people together we don't always talk to talk about these issues is that we can enrich the conversations that are going on. I know that in the mental health policy space, in the advocacy space, we spend a vast amount of time dealing with the questions of mental health parity that has been the framework for much of mental health care policy for the last 30 or 40 years, including, of course, the recent regulations that were issued. And rather than getting into the ticky-tacky details of why pieces of this are workable or unworkable or problematic or make sense, I think that stepping back and looking at the overarching set of issues that are faced by the mental health community and in mental health policy really do get to some of the issues that we talk about in health policy all the time. Foremost for me among these is the issue of workforce and whether there's actually an adequate workforce to address the mental health needs of society in general. Is it adequate in total? I think most of us would agree it's generally maldistributed geographically, and certainly in terms of its diversity, the workforce is not really reflective of the broader diversity in our society. And so these are issues, and there are policy issues underneath all of these things, and our intention in this series has been in that space to think about, okay, can we work together, can we think with others about developing more creative solutions to some of the problems that we're facing? I could say the same thing in the area of quality. Mental health quality is an issue that is, there's many, many people doing incredible work in the space of improving the quality of the mental health and wellness services that are provided. Those are not always that visible to policymakers, and the policy solutions in that space are not immediately obvious. And that is a critical aspect that requires more dialogue and bringing people together. And that's one of the reasons that we really want to bring everybody together here today. We've seen it. I think you're all here because you care about this. I could recite the facts about 1 in 5 adults in our society living with a mental illness or condition, the rates of youth psychological distress in the wake of can I call it a recently concluded pandemic? I don't know if I can say that. But we know that coming out of that extraordinary time in our society, things have changed and needs have changed. And there's a much more intense need for psychological support and different approaches to helping people get through what's going on. So at Kaiser Permanente, let me say one other thing at the outset. At Kaiser Permanente, we have an extraordinary team of people who are working on mental health services every day, figuring out how to do a better job of providing access, improving the care that's there. We have had our challenges over the last few years, which many people have heard about and are aware of. And a piece of that is because of the nature of our organization. What happens inside our organization is much more apparent and much more visible than it is in the diffused, networked kind of society that most of the health system operates in. So we're aware of issues that we have. We have a tremendous desire to address those issues, and we're really committed. Our commitment here and to continue talking about health policy in that space relates to that as well. I want to highlight a couple of things that I just think are amazing programs that we have at Kaiser Permanente. One of my favorite things ever created in our organization in the 30 years I've been there has been the Mental Health Scholars Academy that is in place and is training Kaiser Permanente employees in other fields who are interested in transitioning into mental health services. We have a couple of colleagues among our team and adjacent teams who are going into this program because they care so much about this, they feel called to it, and we're making it possible through this program that they can continue in their current jobs, they can get the training, and when it's the right time, they can transition into getting the hours they need around their schedule in order to get fully trained and then transition into the mental health workforce. And I can tell you, if people like this are the ones who are coming in to the mental health field, I am vastly more optimistic about what our future looks like. These are amazing people who care extraordinarily coming into this field. In that program, 2/3 of the students, the employees and students, are people of color, which is remarkable. One of the biggest problems we have is the lack of diversity in the mental health workforce. I think it's about half are bilingual. Addressing, and this is a tiny little piece of addressing what is a critical question about whether there's enough linguistic capacity to deal with people of all backgrounds in the mental health space. We're also addressing the mental health professional shortages in our communities and increasing the number of professionals in the field by creating and funding a mental health workforce accelerator program. That program is to provide information, resources, and training to develop skills, helping protect physical, emotional, mental health through adversity, trauma, and other distress. So these are amazing programs, and while we are a large organization, we cannot do this at scale and solve the entire problem. We want to share what we're learning, but even more important, we know we don't have all the answers. We want to learn from everybody else and see how we can involve the lessons that others are learning into the programs that we're developing. So we've got questions. Very interested in hearing. One of the things I love about having these meetings and coming together is hearing the questions that everybody else has of us, because that really informs how we need to be, what other directions do we need to do to break down our own internal thinking. When we get convinced of the way we think about things, I think we know that's not the best thing. We really need to have constant pressure pushing on what we think we know, and the only way we can do that is by learning from listening to other folks. In my role in government relations, I'm constantly thinking about where can we address this in policy, and I'm very interested in hearing your ideas around that, and as is the entire team. So with that, let me introduce our keynote speaker, Teresa Nguyen. Teresa's Mental Health America's Chief Research Officer. She leads the organization's Center for Research and Innovation. In that role, she works to improve access to mental health care through data and digital-based innovations. Areas of interest include prevention, early intervention, education, and building a full recovery-oriented mental health system of care. This is actually an area I'm very curious to hear about. Prior to my work at the Public Health Institute, I sat for 9 years on an organization's board, the East Bay Agency for Children, which is like right in this space, providing lots of these types of services in Alameda County and getting to see the gaps, the opportunities. There's tons of policy opportunities in this space, so I'm really curious to hear more about that. Teresa's a licensed clinical social worker with 20 years of experience in mental health as a clinician, educator, and advocate, focused on children and adults with serious mental illness, people experiencing homelessness, dual diagnosis treatment, and early intervention of psychosis. As an advocate, she works to build consumer-based mental health workforce, improve access to treatment through community-based and recovery-oriented mental health programs, and address the needs of underserved communities. This list goes on. It's really quite remarkable. So I could continue, but involved in U.S. Olympic and Paralympic Committee Mental Health Task Force, which is fantastic, Mental Health Research Network Advisory Committee, and PCORI. And PCORI is an area where there's a lot of great policy that goes on. So I'm very glad that she's involved there. So let me invite Teresa up to the stage. Thank you.